Hello and welcome to our online patient meeting. I hope you had a wonderful weekend and are ready to discuss another topic that we are having tonight. And it's 6 p.m. UK time, therefore we will start off with our online patient meeting. And today with us is Sarah Banks. Hi Sarah, how are you tonight?
Hi, I'm good, thank you. Thanks for
Happy
having
to
me.
have you back. As you already had one of our webinars, and tonight this is another one. So we are definitely excited to have you here with us. And thanks for also supporting our our Stronger Together initiative. And I would like to say to everyone that Sarah is not only our speaker tonight, but she's also supporting Stronger Together. She's one of our ambassadors and also partners. So huge thanks, Sarah, for this. It's a pleasure to have you on board with us and for your support, just like that. And of course, you can see all the rest of the ambassadors and partners on the screen right now. As you can see, there are more supporters. So again, thanks to them for their help. And well, tonight, as I've mentioned, we have another topic, and this time it's helping you cope through the uncertainty of coronavirus, and everyone is waiting for the treatments to be reopened. So we are definitely keeping our fingers crossed it will be possible very, very soon. And Sarah today will simply help you out a bit. So remember, you will be able to ask your questions. We will start with some common questions that probably you are thinking about as well. But also remember to type in those questions, and simply Sarah, I'm sure, will be able to have some tips for you as well. And we will start with your introduction, Sarah, right? And then we will go for the questions.
Okay, great.
Perfect.
So hi, I'm Sarah. I have had my own infertility and IVF journey. So we tried for 6 years before our second round of IVF was successful, and we had my son. So going through that, I realised that there was a huge lack of support for people who were going through treatment. So once it had worked for us and I felt in a place where I could help more, I retrained to become a fertility coach so that I could support people who were still going through treatment. So now I work with individuals, coaching them, and I also work with clinics to increase the emotional support that they give to patients, because I believe if they can increase the support they offer, it helps all the patients that come in. I also run support groups online and face to face. So if you do want to join my support group, it's called TTC Support UK, and you're welcome to join. I also recently launched my coaching journal called the IVF Positivity Planner to help support people through treatment as well. So thank you for inviting me to be on. Hopefully I can help with some of the questions that you've got around coping through the uncertainty at the minute. So there's obviously a lot of uncertainty generally for all of us. Depending on whereabouts you are in the world, we were just saying we're all in it together and at various stages of lockdown and things all together. And I know there's a lot of uncertainty around treatment. So in the UK, the clinics were able to apply to open from the 11th of May. So the HFEA have already approved quite a lot to reopen, and treatment is starting. But I know there's still a lot of uncertainty elsewhere around the world if your treatment hasn't, if clinics haven't been allowed to open, but also those where the clinics have opened around when their treatment will start, how it might have impacted their place in the waiting list, what it will mean for them going through treatment. And obviously, there's a huge emotional impact. I know for me, when we were going through treatment, that any delay was a huge emotional impact. I measured time in months, and every month that went by was another month that I wasn't pregnant. So I know that the delay of treatment is really hard emotionally as well. So just to start with, and some of this may get covered again in questions that get asked, so please do ask if you have any more questions on it. But I wanted to just give you a few tips to start with on things that will help coping through this uncertainty. So the first thing is breathe. It's really great if you're starting to feel panicked about things, just to breathe in through your nose, out through your mouth, deep breaths, just really calming. So when you feel that you're being triggered, Are you starting to feel that panic about what's going to happen? And generally around everything to do with the virus can be quite triggering and induce panic at the minute. Try and use those breathing techniques, because they're a great way to calm yourself before you can then think clearly, to think about what you could do to help you take back control. Use your support network. I'll go on to it in one of the commonly asked questions, but people like counsellors, support groups, Instagram. Use your support network to help get you through this, and call on your friends. Have a think about the things that are good in your life. So if you are panicking about treatment and what it means for you and your chances in general of conceiving, try and look at the things that are really good in your life at the minute, because I think we sometimes forget to do that, and we think about all the things we don't have and how it's going to negatively impact our life. So try and have a think about some of those things that are good in your life. Use the time to get some rest. A lot of us, or if not all of us, are in enforced lockdowns at the minute. If you can get rest, I know many of you may be working at home, maybe having to go out to work now, but try and use the time to rest as much as you can. Get fresh air as much as you can, all things just to help you with that coping. And make sure that you're scheduling in time for self-care as well while you're inside. Try and do the things that help keep you calm, meditating, reading, journaling, those sorts of things that help keep you calm and help whilst we're in this enforced lockdown. And then, as I say, I'll come on to some of these things in the commonly asked questions, but I think it's just checking in with your clinic. So the best place to get information is to check in with your clinic personally, and then you know the exact facts rather than worrying about what might happen. It's always best to check in with those. So there's a lot of things you can be doing while you're waiting for treatment to start again. And the biggest thing you can do is to just get yourself ready to start treatment whenever you are able to start treatment, physically and emotionally. So resting, eating well, and looking after yourself emotionally. They're the best things you can do. So as I say, I'll come on to some of those in the commonly asked questions, and you may have some questions on that yourself. So if you want to start with the questions, Caroline, we can go into those if you like.
Yes, perfect. Thank you so much for that introduction. And we will go for the questions right now, starting with this very important question. How can I access support through the ongoing uncertainty of timescales for my treatment starting?
Okay, so as I mentioned before, there is a lot of support available, and it's really, really important to get support. And there's various ways you can get that. So counsellors that are linked to clinics are still running sessions. So they're doing sessions via Zoom, via Skype. So they're doing online sessions, phone sessions, so that they can keep that support going. So if you contact your clinic, they'll be able to book you an appointment with a fertility counsellor. If there isn't one linked to your clinic, or you want to see somebody separately, or you're not actually with a clinic at the minute, you can look on BICA's website, so BICA, which is the British Infertility Counselling Association. They have a list of counsellors, so you can type in your location and search for counsellors in your local area. So I would really recommend, if you're struggling emotionally, to access that support. I know a lot of people I've spoken to have been impacted very much by this emotionally, and what it means for them, especially if they're worried about how it will affect their future fertility and chances to have a child. So I would recommend getting in touch with a counsellor, even if you just have one session, to check if it's right for you and if it's helpful. As I said, online support groups are great. The ones that I run a local one and a national one, have been really busy with people supporting each other amazingly through this and keeping each other updated, sharing tips. Mine, and I think most others that are around, are closed, so nobody outside the group can see what you're writing. So they're a safe space to share support for one another and get advice as well. So they're a great way of doing that. As I say, you're more than welcome to join my group. It's free. It's called TTC Support UK, and we can put the details for anybody who wants them. Speak to the staff at the clinic if you're linked to a clinic about the support that they can offer. They may have links to different support services as well. The nurses are there to support you. So if you're struggling, you can speak to the clinic as well. As I mentioned, Instagram is great for supportive accounts. So if you're following people on there, there's a lot of people who will be in exactly the same situation that you're in. So you can support each other through that as well. And then obviously friends and family. So if you've told friends and family, they can be a great source of support. And unfortunately, you may not be able to see them at the minute, as many of us can't, but they're there on the phone or Zoom. So rely on them as well. Talk to them about how you're feeling if you feel comfortable to do that, and use your support network.
Excellent. Thank you so much for those tips. Definitely useful. And now let me go to the next question. So, what can I do when my treatment has been delayed to make the most of this time?
So, as I mentioned before, the best thing you can do is to get yourself ready to start treatment again. So, you may not know when it will be, but you can get yourself ready. So, that includes physically, so eating well, eating the recommended daily intake of fruit and vegetables, taking recommended vitamins. So, again, your clinic will recommend those. Get lots of rest, use it as an opportunity to catch up. We're very often rushing about, and you may be having to go back out to work still. But maybe some of the other things that you rushed about to aren't happening. So use that time where you'd usually be rushing about from different appointments, your commute to work where maybe you're not anymore. Use that time to rest, to do things that help you feel calm. And maybe that is starting to meditate rather than your half an hour daily commute. Use that time to journal how you're feeling for the day, or what you'd like to get done, or meditate for half an hour, whatever it is that works for you, or read a book. Get lots of rest, get lots of sleep, and get yourself emotionally ready. So having a think about how you want to feel when you're going through treatment and addressing some of those things. Maybe it's trying to manage some of those negative thoughts around it. If you're worrying about treatment starting, think about what you could do to manage those thoughts. So that could be speaking to a counsellor or a coach. It could be speaking to your clinic about the worries you've got so that it puts those at rest. It could be, unfortunately, some of the things like acupuncture and reflexology you probably can't go to at the minute, but you could always see if they do phone consultations just for the talking therapy side of it. Do things that help reduce your anxiety, so things that help calm you, and avoid the things that really do increase your anxiety. So maybe don't watch the daily briefings that we have in the UK, or your country's briefings if you don't want to feel anxious every day, or don't look on certain social media if you find that it's quite triggering. So look at things you can do to reduce that anxiety, and spend time as a couple together to help you cope through it together. Use that time to bond, to talk about how you're feeling about treatment starting, and then also get support. A bit of a common theme, but it's really, really important, and there's so much out there that you can access as well.
Perfect. Thank you so much again for that. Okay, next question is how can I take back some control of the situation?
Well, I know certainly from my point of view, and a lot of the people that I speak to, that a really big thing generally with going through fertility treatment and needing fertility treatment is feeling out of control of your life. And you have to give the control of your future of having a child to your fertility clinic. And suddenly even that's being taken away. So I know a lot of people are feeling really out of control at the minute. So it's really important just to try and focus on some of the things that you can control at the minute. So what I'd recommend is making a list of things that you can control. So things like keeping fully informed. So you can ring your clinic to find out the situation with your specific situation. You can keep an eye on their social media, their website, for all the information so that you're fully informed of when you need to contact them to get started again, what their process of prioritization might be, and if they have one, how things will be in the clinic when you get back. Do you need to organise getting a mask? Do you need to work out different timings for going. Can your partner come? So make a list of things that you can control there so you can keep informed. Right, you could write a list of all the questions that you have for when you start treatment again, in terms of timings, in terms of your actual treatment, so that when you get the go ahead to start treatment again, you've got that list prepared. As I said in the last one, look after yourself physically and emotionally, so you can control, like, you can control what you're eating, and you can control how much rest you get in. Make a list of all those things that you have control of. Planning each day while you're in lockdown, so if you're not able to work, trying to keep some kind of schedule going so that you're getting up and getting dressed, so that you're keeping some normality and routine going. You can plan things that you do while you're in lockdown if there's something you really wanted to do for a while. Whether it's looking for a new job, you could start doing the CV. If it's decorating a room, you could maybe look at doing that. I know quite a few people who've been doing that during lockdown. And then also, it might be helpful to you to write a list of the things that you can't control, because then you can accept that they are out of your control, unfortunately, and then try to stop worrying about them, because it doesn't matter how much you worry about it, there's nothing you can do. So it might be that you can't control, you can't control when treatment starts, you can't control what happens with the virus, and as much as you worry about it, and as much as we would love to control that, it's out of your hands, and it's one less thing for you to worry about. So I would say to take back control, write a list of things. And I do like a list to help me feel organised, and it just helps you look at the things you can do. And I think you'll realise that there are a lot of things you can control in this situation, which will just help you feel like you're doing everything you can.
Perfect. Thank you so much. Definitely a list sounds like a good plan. So thanks for that tip. Definitely. Okay. And so if you could tell us, what can I do to help whenever I'm feeling anxious about treatment delays and then getting started again?
Okay, so again, some of the things that I've mentioned previously, breathe. Sometimes when we get really overwhelmed and everything gets a bit too much, you can feel like that panic starting to rise, and your chest, your heart starting to beat faster, and it just gets a bit too much. And I think trying to just breathe, just to calm your mind, calm your body down, just really deep breaths, and just calm yourself so that you can then think a bit more rationally about it. And it is overwhelming. I don't think there's many people at the minute who don't feel overwhelmed by part of what we're all going through. And unfortunately, those that have had treatment delays, it's just another layer on top of what's happening generally. So breathe, try to help yourself feel calmer so that you can then think of ways to, like I say, take control back, things you could do to help yourself. Speak to your clinic to get the right facts for your situation. So it's great we have social media and blogs, but sometimes the information isn't always correct, or it might be correct for somebody else's clinic or somebody else's situation. And I think if you're reading lots of different bits of information, it can get very overwhelming, and you start to worry that your treatment will be delayed, that things that have happened to somebody else might happen to you. So I think to get the clear facts and the correct facts for you and for your clinic is really important, because it can help with some of those feelings of anxiety, because you know what's happening specifically to you. And it avoids the additional worry of some of these things happening. And as I've said before, do things that help you feel calm. So if you start feeling anxious about it, if you're reading a book, have a read of your book, meditate, do some journaling around how you're feeling, put on a film, go for a walk. I think it's trying to keep yourself occupied as well, and do the things that are calming and relaxing for you, rather than things that are going to fuel that anxiety. So things like Googling and going on social media may be things that fuel that anxiety. So it's getting the clear facts and doing things that you know are right for you to help you keep calm.
Perfect. Thank you so much once again. Now it is our last question when it comes to those most common ones, and then we will move on to your questions. So don't forget to ask anything that you have in mind, and I'm sure Sarah will have some more tips for you. So go ahead and do it. And now the question is, so how can I find out the most up-to-date information on what will happen with my treatment?
Okay, so the best place to find out the correct information for your specific situation is to ring your clinic that you're linked to. So if you were linked to a clinic already, the best thing to do is to contact them and find out what's going to happen with your specific situation. So they'll be able to tell you if you were partway through a fresh cycle and you had to have everything frozen, they'll be able to tell you the next steps and when you need to contact them and what the process will be. If you were just about to do your paperwork appointment, they may be able to get that through and get you started on that already. So the best place is contacting your clinic. So they may have Q&A sessions on it that you could join. They may do a webinar. They will update their social media and their website, so you can find out information from there, or you can contact the clinic. Be mindful that they may be getting a lot of calls, so you may not be able to get through straight away. But what I hear from clinics is actually for specific questions about people's personal situations, and the clinic is the best way because they can obviously only share generic information, but the Q&As are really good with your specific clinic for asking your question as well. So the best place is with your actual clinic. If you're not already linked to a clinic and you're looking at clinics, then you maybe need to check their websites, give them a call and find out what it means for new patients or just being referred patients. In the UK, keep an eye on the HFEA's website. So they're doing regular updates. They're updating on which clinics have been approved to reopen. So they've got a frequently asked questions section on there that tells you lots of information about how COVID is seen to impact fertility or pregnancy. Any links there, it's all on their website. So the HFEA is a great place to go. And then if you're in a different country, any regulatory bodies, I would assume would be the same as well. So you can find out the information on there as well.
Excellent. Thank you so much for those questions, answering those questions. And now it will be time for your questions. So again, let me remind you, all you need to do is type it in and we will start with the very first question. All right, are you ready, Sarah, for the very first question from the patient?
Yeah.
Okay, excellent. So there are infos about the risk of COVID and a fertility preservation treatment. Anything you've heard about?
I'm not medically trained, so I'm unable to answer specifically about how it impacts fertility, I'm afraid. I really wouldn't like to tell you something that wasn't correct. I think they feel the risk is very low, which is why clinics have been allowed to reopen. Depending on where you are, I think fertility preservation I think that was the only treatment that was still happening through the uncertainty. So you may find that if treatment hasn't started again, then you may still be able to have fertility preservation treatment. If you're linked to a clinic, the best thing to do would be to ring them and ask for advice on that. You could look on the HFEA website because the frequently asked questions, I'm fairly certain, have something about, is there any risk of going through fertility treatment and any subsequent pregnancies that happen through fertility treatment. So I'm fairly certain there's something on the HFEA website about that in their coronavirus updates. But probably if you are linked to a clinic, it's probably best checking with them from a medical point of view and whether they're running as well. I hope that helps.
Of course, thank you so much. And actually, there's another question. Again, it's if it's having an impact, so perhaps you can add something. I continued with my treatment during the corona times, but unlike other times I did already 10 times before, my body badly responded to the perigovaries, meaning after day 6 the follicle size has decreased. Do you think this could be attributed to COVID?
Again, unfortunately, I wouldn't know from a medical point of view because I'm not medically trained. But what I would say is speak to your clinic. So see if you can get a virtual appointment with them if they do virtual appointments, or ring them, and if they can't answer it there and then, if you can book in an appointment with them and talk through it and just talk through your concerns around it. I don't believe that it's COVID is affecting fertility treatment, but I would say that everybody's different, and I don't know how every person would be impacted if it could have a negative impact on you. If it's if you've had, I don't know if you've had COVID and you're worried that that could have affected it. I know that certainly in the UK, or I believe in the UK, that if you are showing signs of having COVID, then you they would stop your treatment. So I assume that's partly around a risk factor of being in the clinic and things like that. The best thing to do would be to speak to your consultant around that, and see if you can get a virtual appointment with them to have a longer chat about it and ask their thoughts on it and what to do going forward, if that's okay.
Of course, thank you so much. Yes, I think that you are perfectly right. That it's definitely something you should be able to discuss with your clinic, as they should be able to help you out. And well, we definitely hope it will be all okay for you, and they will get back to you with some more details. Okay, there's another question right here, and I feel a bit confused as to who actually is going to decide in case of going for a donation abroad. How can I keep in viewing which clinics in Europe will reopen when and which airports, etc.? I feel this arbitrary even within Europe. Anything you could advise?
Yeah, it's really hard, isn't it? There's so many different factors. And in all honesty, I'm not sure who would decide. I guess if you were linked to a clinic in the UK, they could help you manage going abroad for the egg donation. If they have a linked clinic abroad, they would be able to advise, because they'll be monitoring very closely. But it will come down to probably three factors: whether the clinic in the UK is open, the clinic in the country that you're going to is open, and also flights getting there. So I'm trying to think where, I mean, you could contact Fertility Network. They may have some ideas. Fertility Network in the UK is the leading charity who support people through fertility, infertility, and going through treatment. They may have ideas about that. If you're with a clinic that is in the UK, you could speak to them about their links with the clinic abroad. If you're going direct to the clinic abroad, they will be able to answer when you're able to go for treatment, or when they're open for treatment. So they may be able to answer that for you. But then it's the flights across and staying over there. So the clinic abroad, if you're going direct to them, quite often will liaise with hotels, or they may be able to advise local hotels that are open in terms of organising the logistics there. But I think you're probably going to be limited by flights to and from other countries when the airport's open. So I'm not sure which country you're in, because there's also in the UK, there's going to be the quarantine when you come back into the UK for 14 days, other than from France and Ireland. So that may impact on any decision if you needed support when you come, if you were going from the UK and coming back to the UK after transfer. I think depending on whether you're through a clinic in the UK or direct from Belgium to Cyprus. So if you are already with a clinic in Belgium and who are helping you through a clinic in Cyprus, I'm not sure if they have links or if you're going direct to Cyprus, but I'd say speak to the clinic where you're having egg donation and find out when they're opening, when they're starting treatment, what their recommendations would be, because you won't be the only patient that they're having who's doing a similar thing. So they will have to look at how it works for any patients that are coming from other countries, when that can safely start again, in terms of airports opening, in terms of safety coming to and going to and from the different countries. So it might be a bit of having to check it out with a few different people. It's such a lot of uncertainty and so many different things linked there, and it will depend in Belgium on flights as well when airports opened. I was saying already asked and saying not sure.
Hmm.
Um,
As you can see, there is like a very similar question. Yeah, so I will show it and read it, but it's like you already kind of answered. But I would like to follow up with this question above. Do you know any of sources that can help with finding out about international treatments and what the plan is? We are now paused in our treatment, which was due to happen in Spain. So,
yeah, I'm wondering maybe the HFEA may be able to advise if you're going from the UK to Spain, or if you're linked. I think it does depend on the different situations. If you're from one clinic traveling to another, then the liaison should be happening between them. Trying to think who.
mhm. Well, it's like I would say that remember that of course every single country, because I see patients are writing that they are wanting this treatment for doing it in Greece, for example. So it's I would say that every country might have different, um, in Greece, as I've heard, they do not have so many. They didn't have so many infected people, so it might be a bit faster. Because I've heard that, of course, lots of those clinics there are already reopened. However, it's not possible to travel, so it's like we are waiting for that part. Yes, when we are able to travel, then you will be able to go ahead.
Yeah, and it might be because there are so many things, a case of keeping an eye on all the international advice for your specific country about when flights are able to start again, what happens in terms of quarantine. But if you're already with a clinic, I think you're probably in a better position in that they will be looking at all of this for their patients because, as I say, you won't be the only one who's traveling. So, from their point of view, it would make sense that they would be checking what's happening and how they can help those patients. So I think your first protocol is probably clinic. If you've if the answer was I've already asked and they say they're not sure, I think maybe it's a case of continually checking in with them. If you're in Belgium, I'm not sure if the HFEA would be able to advise, and it does depend on the government's opening of flights. Things are very up in the air in the UK at the minute, and as I say, there's the quarantine case, and then also feeling comfortable about flying over. So I'd say the clinic's probably the first point of call, and keep checking in with them. Ask if they're not sure now what they need to find out for them to be sure, or when they think they'll have a better idea of what's happening, so that you know when to call them again to get some information. Because I understand it must be very, very difficult for you not knowing what's going on with this, and there's so many more complications than if you were having treatment in the clinic down the road from you. So I'd say in this time get what support you can as well, just to help with that.
Yes, exactly. So we are definitely all waiting. And I think that I totally agree with Sarah that it's just, I guess, we need to wait and ask the clinics, because this kind of situation changes quite rapidly. So do check with your clinic, and I believe they will be able to help you out in, if not now, pretty soon. We are definitely hoping for that. Um,
Mm.
okay, there are some other okay, I will show you right here. I have been going through a first fertility preservation cycle in the UK, but I would like to go this for the second cycle in a different country. How things will be managed once I decide to use my eggs in order to move forward with an IVF treatment. So again, not certain yet.
Yeah, so just to clarify, so is that so a second preservation cycle in a different country? If so, they may have different regulations on storing and where you could have the transfer done and moving to and from countries. I'm not sure. Trying to think where the best place would be to ask about that. I mean, obviously there's the uncertainty around, as we've just talked about, around the travel to different countries that does put another side of it. And I think although preservation's been happening in the UK, it would be the travel side that would impact you. So even if they're doing fertility preservation in another country, it would be the issue would be getting there, I think, at the minute, because of the uncertainty around flights. So I'm just trying to check that I've answer that, or if there's anything else I can help with on that, how things will be managed once I decide to use my eggs in order to move forward with an IVF treatment. So yeah, I think then if you do have a second cycle of preservation in another country, it'd then just be deciding where you'd want the transfer to be done. So if you wanted to have a transfer done in another country, you'd have the choice then of using the eggs that you preserved in that country, or looking at whether you can move them across from where you are. So the clinic that you had your preservation cycle with in the UK may be able to tell you if you could safely transfer them abroad when you chose to use them. But yeah, I think it'll just be when we can travel around more freely that you're able to go across to do it.
Excellent. Thank you so much again, of course. And well, there are some, maybe not questions, however, some comments I think that might be interesting also. So Greece is open up to individual traveling to the site if happy getting on a plane without everyone wearing masks. And now there is this type of risk, right, going abroad.
If Greece is open now to people traveling there, then that's a positive, and it then, at least if they're open for people traveling there, it's then just a case of once the UK is open for people going there and you feeling comfortable flying. I think the airlines over the coming months will have to put different safeguarding measures in place, and I'm sure they're discussing that at the minute about how they can manage that, whether it's people traveling wearing masks, whether that's only having half the passengers. They'll have to look at that, because there'll be a lot of people who are probably going to be afraid to fly or a bit wary of flying for a while. So it will be a case of once we open up again. So hopefully that's reassuring. If from the Cyprus end, if that is open, then it's just waiting for the UK to open. And I think we're probably quite a few weeks behind quite a lot of the other countries in terms of things happening. So hopefully you won't have to wait too long.
Exactly. We are definitely all hoping for that. And actually, there is another part patient has added when it comes to Greece. So that will be interesting for everyone, I believe. In Greece, you'll have to be in social isolation for 14 days. I think Greece is opening the borders for the tourists as of 1st of July. Possibly you can already fly in if you have a certificate that you are COVID free. So I believe that some of the clinics already have been thinking about what to do, how to treat patients. Of course, they're starting the treatment. The only thing is that we simply cannot yet travel.
Yeah, and I guess the clinics will be able to help with that, because if you're traveling to a country where you do have to be in isolation to start with, that will obviously affect treatment. And if you then have to be in quarantine for 14 days, it might extend the time you have to be there. So the clinics will have to consider that to be able to advise you on how long. It might be that you then have to be there 3 to 4 weeks, depending on your treatment. If you've got 14 days of quarantine first, it might be that countries bring in, if there's a quicker test is developed, that they may be able to test before you fly, so you don't have to. As time goes on, things are being developed so quickly that hopefully everybody's thinking, and I'm sure they are, ways that we can make things work and start hopefully getting back to normal soon. But yeah, I think the clinics in the UK have had to submit very detailed information about how they'll keep patients safe and what they'll do in the clinic. So I would imagine clinics abroad are very much having to do the same thing. They have to think about their patient safety, and from their point of view, from a business point of view, they need to be looking at how they can keep patients coming in. And obviously, from an ethical point of view, they want to help the patients that they've already started to see that are coming through. So they will have things in place. And maybe it's just a case of checking in every few days with the clinic, watching their social media, giving them a call, sending them an email to check in with them.
Yes, exactly. So we are definitely all hoping for that. And well, there is just a second. Here it is. Any psychological trick to go to advanced level of preparation?
I think it's just a case of, if you so from an emotional point of view in getting ready to start treatment, I think It's things like managing the negative thoughts that you have. So I certainly, when I was going through my second cycle, struggled to think that it could work for us because my first cycle hadn't. So for me, a big part of getting ready was managing some of those negative thoughts and reminding myself that actually there was still a chance this could happen for us, just because the experience I'd had didn't show that it could work for us. We'd had a negative cycle to start with. So I had to work on my negative thoughts going into it. So I know everybody says stay positive, and it's not about being positive all the time, but it is about managing some of those negative thoughts. So when you start thinking that it isn't going to work, that it's going to have impacted your chances of it working, try to remind yourself that that isn't necessarily true. You're doing everything you can to stay in the best shape you can be for going into it. Look at things that help keep you calm. Try and stop that cycle of worry that we all get into. One thing sparks it off, and you can quickly find yourself right at the bottom of a hole of worry. So it's managing those negative thoughts. So for me, when I had those, I used to click my fingers to snap myself out and say, stop it, it's not helping. My worry I used to tell myself my worry is going to make it less likely to happen for me, because it was something that snapped me out of that cycle. And so I think it's managing those negative thoughts going into it, that there's still every chance this could happen for you. You've got to believe that there is still a chance. So managing the negative thoughts, doing things that help you cope. So for everybody that's different. But if you're struggling psychologically, if you're really worrying, if you've had, if you've been through quite a lot of cycles, or you've suffered a loss at some point and you're really struggling psychologically to go into it, then I definitely recommend speaking to a counsellor to get some more psychological support as well, because they can help manage some of those deeper seated fears, and manage some of the emotions around any loss that you've been through as well. So I would say I'd always recommend speaking to a counsellor before you start treatment, just from the point of view that if it works for you, then it's amazing. If it's not really you, then you've tried it and you can say, well, I've tried it and it wasn't really for me. But I think to get the support going through treatment is really important. So I'd say that the biggest thing is managing those negative thoughts, that you don't spiral. I hope that helps.
Perfect. Thank you so much for that. And actually, we have another question. It looks like it will be our last question. However, if you have any left, go ahead and type it in. There are times when you feel that you're losing a battle and everything is going against you, although with the current situation, you cannot do anything. What can you do to get over these waves of sad thoughts and helplessness?
Yeah, I completely understand. I mean, it's hard enough as it is. When you're struggling to get pregnant and you're going through treatment, and then on top of that, no one could predict what's happened now, and the thoughts that come with that, and it is very hard. So it comes back to kind of trying to take control of the things you can do, because unfortunately, even from the questions we've seen, that there's very little we can control in terms of when the clinics open, when airports open. But it's trying to control the things you can control. So you can control how much rest you get and how you look after yourself. You can control distracting yourself and using coping mechanisms to help when you're feeling those things. So as I just mentioned, managing negative thoughts when you're getting them. So looking at what it is that what your worry is. So just as an example, thinking that the clinics are never going to open. It's an extreme because they will open, but just as an example, looking at it rationally, well, they will, and they will do it when it's safe. And actually that's the best time to do it, because you want to make sure that you're safe and healthy as well whilst you're going through it. The best chance you've got is being well and healthy when you're going through it. So I know it's really hard when you feel really out of control about this, and it's really, you feel sad about the situation, but just remind yourself that it's better to go through treatment once they've got this under control and it's safer for you and you're in a better place. Use your support network. So this is where support groups are really, really good. the ones I run, I have comments, regular comments every day about people feeling very similar things. So I'm just having a really bad day. And then you just get a load of amazing people who completely get it, replying, trying to help, reminding somebody how strong they're being, giving advice on things that have worked for them. And I think then it's a safe place to talk openly. And unfortunately, people who haven't been through treatment don't always get what we're going through. So friends and family maybe don't understand why you're so upset on a day-to-day basis about things, but it does affect us that way. Whereas support groups are great for that. They will help, and they'll help keep you up. So I think make a list of all the things you can control. And even if that is things like ringing the clinic every other day to find out any more updates, or checking the clinic's website every day, you'll feel like you're doing something and taking control, focusing on your relationship. And if you're with somebody, focusing on that and spending time as a couple, and you may be in forced lockdown together and seeing a lot of each other as it is, but making quality time to spend together, so that the time you are spending, the time you're waiting to start treatment again, you're at least trying to enjoy it. So having date night in your kitchen, or watching a film together, or Zooming with friends. I think planning something for each day that makes you smile, however small it is. And yes, we are a bit more limited while we're stuck in our houses, but try and plan in something for every day that makes you smile. Write a list of the things that you can control. And as I said before, write a list of the things you can't control if you want, and just kind of almost say, right, I can't control you, so I'm not going to worry about you, and seek support. I think is a huge thing, because it's great to be completely understood when you're feeling like that, and it's not about saying you shouldn't be feeling like that. Everybody feels like that, and it's helping you kind of come back up again. I hope that helps.
Perfect. Thank you so much for all those tips, Sarah. We definitely, I mean, everyone needs it right now. Those kind of support, as you are saying. So, huge thank you. Someone is typing, so I want to give it a minute if we are having any other questions. But we will be slowly finishing. There is a comment I would like everyone to see. So we will be super ready, in top shape, and full of vitamins. Exactly. That's the positive thought that we should definitely remember,
Definitely.
right?
Yeah. And as I said, if people want to join my support group, it's free. It's called TTC Support UK. I am going to see if I can contact somebody at the HFEA to ask about travelling abroad, just to see if I can get any more information. And if I find anything, I'll share it in my group, and I could always email you, Caroline. I don't know if there's any way that we could.
Yes, of course, we would be able to. So, you can just get in touch with me, of course, and I'm sure we will be able to simply add it on our website even, or just share it anywhere on our social media as well, and so that you will be able to check where to find it. We can do it for sure. And Sarah, again, thank you for getting back to us again and doing another webinar with us. And as you can see, there are more thank yous right here. Thank you, Sarah. You're very
Thank
kind
you.
and helpful.
Oh, thank you. I hope it has been helpful, and I'm very happy if anybody wants to contact me. If you've got other questions or just need a bit of moral support, please do contact me. Please join my group. You're more than welcome to. I understand. We weren't going through it during a global crisis, so there's another layer there that you're having to cope with. So if you need any support, please do message me. And you can find me on Instagram under IVF Positivity Planner as well. So you can find me there, and I share lots of content to support you. So if you want more support, I'm around and you can find me.
Excellent. Thank you so much. And just to clarify, the name of the group is TTC?
Yeah. Do you want me to type it into the group?
If you could, definitely. And it is on Facebook, because there's another question.
Yes, it's
Exactly.
on Facebook. So if you just there's just some questions to ask if you want to join. If you could just answer the questions, even if you put that you've seen this Q&A session, just so I know, because I do that to keep the group safe for people, to make sure that it's the people that I'm allowing in genuinely need the support, and keeps it safe.
Exactly. Perfect. Thank you so much. And also, let me remind everyone that if you would like to get in touch with Sarah, you can also click on this link right here in the chat section, and there is an option to ask your question, and that way you will, the Sarah, I'm sure, will be able to get back to you. And well, again, thank you all for joining us tonight, for your questions. We definitely hope that it was helpful for you. So huge thanks for well being here as well. And Sarah, it's always a pleasure to have you here. I just want to remind everyone that this being recorded, of course, therefore within the next few days you will have a chance to watch this again if you need it, whenever you need it. And you can find this on our myivfanswers.com website, but also when you are subscribing to our YouTube channel. That way you will be updated when the new video is uploaded. So I encourage everyone to do it. And that is it for today. However, we are having another event. So please just stay with us at 8 p.m. UK time. We will have another topic, egg preservation, with another doctor. So you can actually find out a bit on that as well. Sarah, again, thank you so much for supporting our initiative. You are our ambassador and partner. So, huge thanks for that and for today as well.
All right, so thank you for having me, and take care and stay safe, everyone, as well, and good luck.
Exactly. Best of luck. And we are definitely keeping our fingers crossed for you, for
Yeah.
all of you. Thank you. Bye.
Okay, thank you. Bye.